Hi Caitlin, my name's Emily. I'll be your student orthoptist for today. How are you?
Good, thanks. How are you?
Pretty good, thank you. So what I'm going to be doing today is a test known as ocular movements. So basically I'm going to be assessing the range of movement of your eyes and how well they're sort of working together.
Ocular movements are defined as voluntary and involuntary movements of the eye to look in a particular direction to acquire, fixate, and track visual stimuli. The muscles of the eye are used in order to look in the direction of an object of interest. In this context, ocular movements is the test performed by eye care professionals to determine whether the extraocular muscles are functioning normally. The test involves observing the eyes as they move across various positions of gaze. Ocular movements are used to identify if there are any overactions or underactions of extraocular muscles. This test can provide information needed to differentiate between a neurogenic palsy or a mechanical restriction. A neurogenic palsy indicates innervation issues, whereas a mechanical restriction indicates a physical limitation of the movement of a muscle. Ocular movements help eye care professionals see how well the eyes are working together. The test also encompasses a component to observe whether A or V patterns of the eyes are present. Ocular movements are of great importance in the diagnosis of eye movement disorders. Eye turns should be assessed in all positions of gaze in order to aid with the diagnosis. When testing ocular movements, the primary aim is to look for any muscles that are overacting or underacting in a particular position of gaze. If the condition is neurogenic, a full or partial muscle sequelae may be seen. Muscle sequelae are the sequence of muscle changes that occur in a response to a neurogenic muscle palsy. Conversely, if a mechanical palsy is identified, movement is generally affected in a range of positions. Versions are used to test ocular movements in 9 positions of gaze. Versions are the movement of both eyes together. If an underaction is observed, ductions are used to gather further information. Ductions are the movement of one eye alone, which can be used to determine whether an underaction is neurogenic or mechanical in nature. To confirm whether an over or underaction is present, ensure to perform a cover test in the diagnostic positions of gaze to verify observations. The H pattern isolates each extraocular muscle and assesses the muscle family itself. It identifies the agonist, the contralateral synergist, the ipsilateral antagonist, and the contralateral antagonist. AV patterns occur when there is a significant change in the horizontal deviation from direct up gaze to direct down gaze. To diagnose a V pattern, a difference of 15 prism diopters or more is needed. Physiological V patterns are naturally present to a certain extent, as the eyes tend to diverge in up gaze and converge in down gaze. More than 15 diopters difference between up gaze and down gaze is not natural and indicates an ocular movement disorder. An A pattern is not physiological, and to diagnose, a 10 prism diopter difference must be measured.
Okay, so keeping your head nice and straight and still, I'm going to get you to follow this torch using only your eyes. And I'm just going to lift your lids up to get a better view. There we go. Yep. Back into the middle. You're doing very good, Caitlin. And once again, I'll lift your lids. Yep. And we're just going to go up and down. And I'll lift your lids once again. Yep, great, we're all done. Thanks, Caitlin.
The H pattern is used to assess the range of ocular movements by looking at the muscle family, which includes the agonist, its contralateral synergist, the ipsilateral antagonist, and the contralateral antagonist. To start, we have the eyes here in primary position and observe any deviation here by looking at the symmetry of the corneal reflections between the eyes. Next, we move into right gaze, or juxtaversion, which assesses the right lateral rectus muscle and the left medial rectus. We then move up into dextral elevation to assess the right superior rectus and the left inferior oblique. From here, we move down to interdextral depression to assess the right inferior rectus and the left superior oblique. We then move through to left gaze, or laver version, to assess the left lateral rectus and the right medial rectus. From here, we move up into laver elevation to assess the left superior rectus and the right inferior oblique. Now we move down into laver depression to assess the left inferior rectus and right superior oblique. To assess AV patterns, we move into direct elevation and direct depression. These positions of gaze do not isolate specific muscles, but assesses muscle function for us to observe whether an alphabet pattern may be present. Ocular movements are clinically tested using corneal reflections in order to gauge symmetry between the eyes. The torch acts as a non-accommodative target for the patient to focus on during testing. If corneal reflections don't look symmetrical in their relative positions in the eyes, a cover test is used to confirm if there is deviation or if the eyes are straight. Here, the cover test is being performed in dextral elevation to determine if the eyes are straight. As there is no movement of the eye observed, no over or under action is present in this position. Ocular movements are graded on a 9-point scale, with 0 meaning there is no underaction or overaction. A minus value between -1 and -4 is indicative of an underaction, and alternatively, positive values of 1 to 4 indicate an overaction. The higher the value, the greater the under or overaction. Some orthoptists will choose to go beyond the 4th point if they feel that the under or overaction is greater. For horizontal underactions, when the eye abducts, we expect to see the corneal limbus touching the outer canthus. In a normal range of movements, there should be no sclera seen. In the opposite direction, when the eye goes into adduction, approximately a third of the cornea is tucked under the punctum. From there, we grade any limitations based on how far off the normal range the movement is. The table here depicts what percentage of function aligns with the grading system for underactions for horizontal and vertical muscles. Overactions of horizontal muscles are graded based on how much cornea is covered by the canthus. The percentage of function system is used to grade the overaction. The image here indicates a visual representation to show the grades of horizontal overactions based on how much pupil is covered. Vertical muscle overactions differ from horizontal muscles in that they are graded in comparison to each eye rather than ocular landmarks. For example, the right eye may be graded in terms of how much higher it is than the left. When grading, compare the heights of the limbus of eyes in comparison to each other and the distance and positions of the eye relative to the palpable fissures. The table here shows examples of vertical overactions and their respective grades. When testing for ocular movements, the following may be observed: over or under actions of muscles, up or down shoots, up or down drifts, and the detection of an A or V pattern. These findings can be recorded descriptively or graphically. The descriptive method shown here describes what the clinician has observed during testing. There are a few different methods of describing the ocular movements which are depicted here. In the first example, OM stands for ocular movements, and NAD indicates no apparent defect. This recording states that this patient has a full range of movement of their extraocular muscles. The second example shows a right inferior oblique overaction as well as a right superior oblique underaction. The overaction of the right inferior oblique is greater than the underaction of the right superior oblique. The final example purely describes what the clinician has observed upon testing without indicating what muscles are impacted. In the graphic method, a diagram is utilized to illustrate the ocular movement assessment. Each position represents specific extraocular muscles' actions. For example, in this image, we have the right superior rectus underacting and the right inferior oblique overacting. The diagonal lines passing through the eyes represent the presence of an A or V pattern, and in this example we have a V pattern as indicated by the direction of the lines. The soft arrows indicate that there is an updrift of the eye here. A drift is described as a slow movement to a new position. If it is a hard angled arrow that's denoted, then an up or down shoot has been observed. A shoot indicates a rapid movement to a new position. A prism cover test has been performed, and they are represented by the prism diopter values shown on the diagram here. If shading is noted in the recording, it indicates a limitation of ductions has been observed upon testing.